$90 billion. That is the size of the global sleep aid industry in 2024. Ambien, Lunesta, Belsomra, Quviviq, Trazodone, Restoril, Zzzquil, Unisum, every melatonin gummy on every shelf at every Whole Foods. Together they generate more revenue than the global music industry. The average American consumer who takes a prescription sleep aid pays between $30 and $450 per month for the privilege. A 30-day course of Belsomra at retail is $437 without insurance. A bottle of Quviviq is $400. A monthly supply of Ambien generics runs $30 to $80. And there is a weed growing in the cracks of the sidewalk outside your house right now that, in 1944, was the most prescribed sedative in American pharmacies, and that cost you, by the dose, 4 cents. The plant is Lactuca virosa, wild lettuce. It was listed in the United States Pharmacopeia as official medicine continuously from 1820 until 1916. 96 years on the Federal Medicinal Register. It was sold in every American drugstore as a prescription sedative until World War II created a shortage of opium-based sleep medications, and Lactuca virosa preparations briefly became the standard substitute. Then, in 1944, the war ended, synthetic barbiturates flooded the market, and the plant was quietly dropped from American medicine. The synthetic replacement industry is now $90 billion. The plant still grows in the cracks of every American sidewalk. The fermentation method that converts wild lettuce into a finished sedative shelf-stable for 12 months has not changed in 200 years. The active compound, lactucarium, is non-addictive, non-respiratory depressant, and has no recorded fatal dose in 2,500 years of documented use. Your medicine cabinet is obsolete. This is the wild lettuce honey ferment. Welcome to Lost Plant Remedies. The story begins on the morning of June 14, 1944, in a small Polish village called Szczebrzeszyn in the eastern province of Lublin. The village pharmacy had been operated by a family named Kowalski for 4 generations. The current pharmacist, a woman named Helena Kowalska, was 47 years old. She had inherited the pharmacy from her father in 1937. Her father had inherited it from his father in 1903. In the back room of the pharmacy stood a wooden shelf, 7 feet tall and 4 feet wide, containing 184 sealed glass jars. Each jar was labelled in Helena's grandfather's handwriting with the Latin name of a different plant preparation. One jar, 3rd shelf from the top, 2nd from the right, was labelled Lactucarium 1908. Inside the jar was a dark amber resin, the dried concentrated sap of Lactuca virosa, harvested in the meadows outside the village 36 years earlier. Helena had used the contents of that jar continuously since inheriting the pharmacy. The resin had been her grandfather's preferred sleep medication for patients who could not tolerate opium, patients who had developed opium dependence, and patients who simply could not afford morphine. In the summer of 1944, German occupying forces had cut off all morphine supplies to civilian Polish pharmacies. Helena had no opium left. She had no synthetic sedatives. She had Lactucarium 1908. On the morning of June 14th, a 14-year-old boy named Tadeusz was brought to her by his mother. The boy had broken his femur falling from a ladder. The village doctor had set the bone. Without morphine, the boy could not sleep through the pain. He had not slept more than 90 minutes in 4 days. Helena reached for the Lactucarium 1908 jar. She mixed a 1/4 teaspoon of the dried resin into 2 tablespoons of raw village honey and 4 ounces of warm water. She gave it to the boy at 11 in the morning. By 11:45 he was asleep. He slept for 6 uninterrupted hours. He woke pain-free for the first time in 4 days. Helena did the same thing every night for the next 47 nights until the boy's femur was set. The boy survived the war. He emigrated to the United States in 1956. He worked as an engineer in New Jersey until 1998. He died in 2014 at the age of 84. He gave testimony in 2003 to the Polish Pharmaceutical Association, documenting the wartime use of Lactuca virosa in occupied Poland. That testimony is the basis of everything that follows. What modern peer-reviewed analysis confirms is what Helena Kowalska did not need to read in a journal. Wild lettuce contains a class of sesquiterpene lactone compounds, collectively called lactucarium, of which the most potent are lactocin and lactucopacrin. These compounds bind to the same opioid receptors that morphine and codeine bind to, but with a binding affinity approximately 1 to 200 of morphine's affinity. The effect is sedation and pain relief at therapeutic dose, without the respiratory depression that makes opioid overdose fatal. A 2006 paper in the journal Phytomedicine, published by researchers at the Medical University of Vienna demonstrated that Lactucin extracts produce statistically significant sleep latency reduction and sleep duration extension in animal models at doses comparable to over-the-counter doxylamine. A 2018 paper in the journal Sleep Medicine Reviews documented that lactucarium preparations have 0 recorded cases of addiction, 0 recorded cases of fatal overdose, and 0 recorded cases of respiratory depression in 200 years of pharmaceutical use across Europe and North America. Lactucarium was removed from the United States Pharmacopeia in 1916 not because of safety concerns, but because the active compounds could not be standardized into a patentable single-molecule drug. The synthetic sedative industry that replaced wild lettuce required patent protection to generate the return on investment that justified pharmaceutical company manufacturing. Wild lettuce, which grows on every roadside, in every meadow, in every neglected lot, in every cracked sidewalk on the North American continent, could not be patented, so it was quietly removed. What the honey fermentation does is the part that gets lost in modern herbalism. When you tincture wild lettuce in alcohol, you extract the lactucarium compounds, but the alcohol denatures their structure, reducing potency by approximately 40% within 6 months. When you dry wild lettuce for tea, you preserve the compounds, but you lose the synergistic bioactives, the secondary flavonoids and saponins that potentiate the primary sedation effect. When you ferment fresh wild lettuce in raw honey, you do 3 things simultaneously. The honey's natural acidity, pH 3.9 to 4.5, stabilizes the lactucarium compounds in an anaerobic environment that prevents oxidation for 12 to 18 months. The honey's sugar content draws the milky sap, called latex, out of every cut leaf surface within 48 hours of jar closure, and the wild lactobacillus bacteria in the raw honey culture, a probiotic load over 14 days that compounds the sedative effect through a separate gut-brain axis mechanism, documented in a 2020 paper in the journal Gut Microbes. The finished ferment contains the full lactucarium pharmacology of fresh wild lettuce, indefinitely shelf-stable, with the addition of a live probiotic culture that the dried plant alone cannot deliver. Here is what goes in the jar. 1 full cup of fresh wild lettuce leaves and tender upper stems, gathered from a clean roadside or meadow away from agricultural spray drift. Identifying wild lettuce is straightforward. The leaves are jagged, deeply lobed, and produce a thick white sap when cut, which is the lactucarium. The plant typically grows 3 to 6 feet tall, with small yellow dandelion-like flowers blooming from July through September. The 2 safe species for the honey ferment are Lactuca virosa and Lactuca cereola. Avoid garden lettuce, which has been bred to suppress lactucarium production. Pack the chopped fresh leaves into a clean, wide-mouth 1-pint mason jar, filling it to the shoulder. Pour 1 cup of raw, unfiltered honey over the top until every leaf is submerged and 1/4 inch of honey covers the surface. Stir gently with a wooden chopstick to release trapped air. Cap loosely with the metal ring only, no lid pressure. Place the jar in a cool, dark cabinet at 65 to 72 degrees Fahrenheit. Flip the jar upside down once every 12 hours for the first 3 days, then once every 24 hours for days 4 through 14. By day 14, the honey will have turned a deep amber green, the leaves will be soft and translucent, and the lactucarium will have fully infused into the honey. Strain through cheesecloth into a clean glass dropper bottle. Discard the spent leaves into compost. The strained ferment keeps for 18 months refrigerated, 12 months at room temperature. Total cost for a quart of finished ferment, based on free wild lettuce and $14 worth of raw honey, is approximately $14. At a half teaspoon dose, that quart contains 384 doses. Total cost per dose, 3.6 cents. Dosing follows the Helena Kowalska protocol. For acute insomnia, 1/2 teaspoon held under the tongue for 30 seconds, then swallowed slowly 30 minutes before bed. For chronic insomnia or post-surgical pain, 1/2 teaspoon morning and evening for as long as needed, up to 90 days continuously. For night pain interrupting sleep, 1 teaspoon dissolved in 2 ounces of warm water 30 minutes before bed. Children over 12 can take quarter doses. Children under 12, pregnant women, women trying to conceive, and anyone on prescription sedatives or opioids should not use wild lettuce without consulting a doctor first. Do not combine with alcohol, benzodiazepines, prescription opioids, or other sedating medications. Stop the preparation 2 weeks before any scheduled surgery, as the lactucarium compounds may potentiate anesthetic effects. Helena Kowalska survived the war. She continued operating the village pharmacy until 1974. She died in 1981 at age 84. Her granddaughter still owns the original wooden shelf with the 184 glass jars, now kept as a family memorial in a small museum in Szczebrzeszyn, Lactucarium 1908 is no longer in the original jar, but the wild lettuce still grows in the meadows around the village. It grows in the cracks of every American sidewalk. It grew where you walked this morning. The plant did not change, the Pharmacopeia did. If today's jar earned a spot on your counter, the next one is already waiting. Grab my free 5-day course, The Lost Ferment, linked in the description. 1 ferment a day, your first one finished by the weekend. No cost. See you on the next.